Many of you are probably dealing with dizziness and you're wondering, what can I do to fix it? It's not just seniors who deal with dizziness or vertigo. It's a lot of people. And joining me now is Burch from Oxford Physical Therapy, who's here to talk about how to treat this in all ages and really all forms. What are we really talking about here? We're talking about dizziness or vertigo or both?
Both. It's called Vestibular Rehab. It's a type of physical therapy that treats patients with dizziness, vertigo, and imbalance. And it can be absolutely debilitating. It comes from a lot of different sources. I'm mainly looking at the vestibular system, which is the inner ear, and how it communicates with the brain. And there can be problems there, whether there's a weakness after a viral infection, the normal aging. There's also debris that's supposed to sit in a certain part of the inner ear, and that can get dislodged and cause symptoms. So a lot has to do with the inner ear, and if it's not functioning properly, people will have these symptoms.
I had a friend whose husband had vertigo. She literally had to drive him to work every day for months and months and months and months and months. And it just eventually, I guess, went away. I don't know. But for some people, this is a chronic situation.
For a lot of people. I mean, it can be debilitating, and they can have it for years. And depending on the problem, some of these issues can be resolved in 3 visits. Other times, if it's a weakness, we're basically strengthening the vestibular system so that they can function during normal activities. That might take 4 to 6 weeks. But the bottom line is, it's very effective, and it can eliminate these symptoms in a fairly short amount of time.
Okay, so why does it feel like I have never heard of this?
Well, I think that's hard to say. It's frustrating for me because I have such good results when I treat these patients. I think the older thoughts were that it'll go away. Yes, that it'll go away in 6 months. But the thing is, I have a lot of patients that it doesn't go away. They've had it for 5 years and they're miserable. They have it positionally. They look up to a cabinet. They bend down to tie their shoe. Every time they do that, every day, they have vertigo. Or from a weakness, they're just trying to make it through daily activities. They have to rest more often. Some days they can't go into work because they're too dizzy, and it just doesn't have to be like that.
All right, I think of physical therapy. I think of my husband's rotator cuff, and he's doing exercise. How do you exercise your inner ear? This is not physical therapy, is it?
It is. There's a very strong connection between the inner ear and the eyes. It's strange. It seems strange, and I have to get people in so that I can evaluate them, and I explain the whole process, and then they're on board because they understand. It's basically, you are strengthening your ear's ability to help you balance and to keep you oriented, so that when you move your head and the ears have to work, you don't get dizzy.
So how do people find out more information? Because we're going to have to wrap this thing up in a second. Because I know we're going to get calls right now, so get your pencil ready.
Yeah. Well, I'm working with Oxford Physical Therapy. Their main number is 701-6100. I work out of the Blue Ash office, centrally located. You can talk with your doctor, primary care doctors, let them know you're having dizziness, that they'd like to try vestibular rehab.
Because they probably need to be referred, right?
Not always. Ohio and Kentucky were direct access states. They can come to me directly, and I can treat them. It's not like that in all the states. But
well, let's hope that lots of people out there who are hearing about this really probably for the first time feel a little more confident that there might be a solution for them out there. Kelly,
yes.
Thanks so much. It's so good to meet you. Thanks for coming in.
Thank you.